Almost 90% of high blood pressure cases are what doctors call essential hypertension, and even with all the science we have, they still don't know what actually causes it. Let me ask you something. What if high blood pressure isn't the problem, but actually a symptom? What if you could lower it naturally, without being stuck on meds with awful side effects for life? Stick around, because I'm going to explain everything. And real quick, always talk to your doctor before you start or stop any medication. The blood pressure system. Here's something wild. Your body has about 100,000 miles of blood vessels. That's enough to go around Earth about 4 times. And those vessels don't just feed your heart. They reach your brain, kidneys, eyes, everything. So when your blood pressure is off, it's not just a heart thing. It can cause memory issues, vision trouble, and even 3 times the risk of stroke. If you're over the age of 60, there's about a 50-50 chance you already have hypertension. That's way too high, in my opinion. The big misunderstanding. Here's what frustrates me. Most people are told, oh, you've got high blood pressure. Take this pill, but no one asks why the pressure is high in the first place. For example, if your lungs aren't getting enough oxygen, like in COPD, your body says, let's raise blood pressure so it can push more oxygen around. Then take it. Boom, even less oxygen gets where it needs to go. No wonder so many people feel worse after starting their blood pressure meds. Low potassium, low magnesium, low vitamin D. Let's break this down further. 3 of the most common reasons for high blood pressure are low potassium, low magnesium, low vitamin D. But what do most doctors say? Cut back on salt. That's it. No mention of potassium, which is actually way more important. And even if they do mention potassium, here's the problem. The pills you buy at the store, they only have 99 milligrams. But your body needs 4,700 milligrams a day. So to meet that need, you'd have to take 47 pills a day. I don't know about you, but I'm not doing that. What diuretics really do. And then they give you a water pill. It's called a diuretic. The common one is hydrochlorothiazide. It does flush out sodium, sure, but it also flushes out potassium and magnesium. So you're now even lower in the minerals that keep your blood pressure healthy. Worse yet, this kind of pill increases something called homocysteine, which raises your risk of heart disease. So yeah, your pressure might drop a bit, but the real cause gets worse behind the scenes. If that doesn't work, they move on to calcium channel blockers. They work from a different angle, but come with their own issues. Take them for 5 years or more and studies show they may shrink brain volume and raise cancer risk. And they're not even that effective. In one study, they lowered blood pressure by only 0.1. That's like dropping from 120 to 119.9. Whoop-de-doo. Then you've got ACE inhibitors. These can cause allergies, or that dry, nagging cough that never seems to go away. The aspirin update. Oh, and remember that old advice, take an aspirin a day to protect your heart? Well, that's out the window now. Turns out, daily aspirin doesn't help most people. A major study found the outcomes weren't great. One newer study did show some promise. But get this, they weren't using aspirin. They used a drug called bufferin, which contains magnesium and beta-carotene. And guess what magnesium does? Yep, it helps lower blood pressure. The nitric oxide game changer. Now here's something you might not know about nitric oxide. It helps your arteries relax and expand, which drops your blood pressure. Some people even use it to help with bedroom performance problems, because it's all about blood flow. Now, not everyone makes enough nitric oxide. If you have a genetic variation, your body might not produce it properly. There's a test for this. It's called ADM, which stands for asymmetrical dimethylarginine. Or you can do a simple DNA test to check the natural remedies that work. Alright, let's get to the stuff that actually helps. Start with L-arginine. It's a natural amino acid that boosts nitric oxide. Add in garlic. It acts like a natural ACE inhibitor and supports nitric oxide. And don't forget celery. About 4 stalks a day can lower adrenaline and help you sleep. Just maybe don't eat it before a long car ride. You'll be stopping at every bathroom. Repair your arteries. Want to support the inside walls of your arteries? Try something called tocotrienols, a special form of vitamin E. They help repair damage, reduce inflammation, and support heart health naturally. Super useful if you've got angina or early signs of heart strain. Putting it all together, so here's your blood pressure toolkit. Eat more leafy greens for potassium and magnesium. Get sunlight or take vitamin D3, at least 20,000 units daily in the winter. Use garlic, celery, and L-arginine regularly. Look into tocotrienols for arterial support. Do this consistently, and you could see big changes without needing a whole shelf of meds. If you've been struggling with high blood pressure, I want you to hear this. it's not your fault. The system hasn't given you the full picture. But now, you've got the tools to take real control. If this helped you, hit that like button, drop a comment, and subscribe. Your support helps this info reach more people who really need it. Want more tips like this? We've got videos coming every week, natural remedies, behind-the-scenes truth, and zero fluff. Make sure to turn on that bell notification and follow our Facebook page for daily updates. And if you've tried any of these tips, I'd love to hear how they worked for you.